Hey, folks. I want to take a minute to talk about one of the foundational muscles we need to have in place in order to be able to safely lift weights. I know a lot of folks are who've maybe never lifted weights before, or who are coming back to lifting weights after maybe decades of not lifting. I know a lot of folks are getting into lifting weights as a strategy to maintain or improve bone density or manage symptoms of perimenopause, and resistance training, lifting weights is a really, really great strategy to do those things. Um, but we do need to have some things in place in order to be able to lift weights safely. And one of those things that needs to be in place is we need to be able to activate our deep core, our transverse abdominis muscles. These are our core stabilizing muscles, a really important core stabilizing muscle. And if we don't have that in place, then we risk injuring ourselves or hurting our back as we lift. Additionally, a lot of folks who have just lower back pain in life, a reason for that back pain can often be weakness or underactivity in our transverse abdominis. And so, building the strength and getting that activation in place is also just really, really helpful from a functional fitness and quality of life point of view. So, what is our transverse abdominis? It's our deepest core muscle. It runs from the bottom of our rib cage, the top of our pelvis, and wraps around into the fascia in our lower back. The muscle fibers are horizontal. And so when the muscle contracts, it squeezes in and provides stability in that way. If you've seen, in the gym or pictures of big muscle lifters, and they wear those belts, those big belts cinched around their waist, those belts serve the same purpose, right? To provide that stability and protect the spine as they lift. So this muscle is our natural way of providing that stability. Um, the problem is for a lot of folks in midlife, we have lost our kind of brain muscle connection, or that connection has grown really weak. Because what is a muscle contraction? A muscle contraction is our brain talking to our muscle and saying, recruiting muscle fibers to contract. And a lot of times that connection can get pretty quiet. And so we need to make sure that we are able to activate that muscle and that we can recruit it as a stabilizing force. And so in this video, I want to demonstrate an exercise that's really, really helpful for building strength in the transverse abdominis muscle. It's called the dead bug. I also want to show you progressions to make sure that we're doing the dead bug correctly and that we're using the correct muscle to activate it. Something that can come up when we are new to exercise, returning after a long break. And we try to do the exercise with correct form. We follow the cues that exercise instructors give. If we don't already have that strength or that neuromuscular control in place, we can sometimes recruit the wrong muscles in an effort to follow the cue. And we don't want to do that here. Doing that can lead to injury or at best be ineffective. So let's take a look at the dead bug and how to activate our transverse abdominis. I'm going to lie down on my back. I have my knees bent, my feet flat on the floor, and my feet about hip width apart. So one cue that you might hear if you're familiar with this exercise is to press your lower back into the floor. That's not a great cue because there's a lot of different ways we might press our lower back into the floor. We might incorrectly recruit our piriformis to do that, or our hip flexors to do that, and that's not what we're looking to do here. We're looking to engage our ab muscles, and specifically our transverse abdominis muscles. So the first cue I'm going to give you, I want you to find the two bony bumps of your pelvis and put your two fingers on them, and then slide those fingers inward a little bit and downward, just a couple centimeters. And the first thing I want you to do is keep your fingers there, pressing in kind of lightly, and draw your belly button to your spine. As you draw your belly button to your spine, do you feel the muscles beneath your fingers contract? If you do, awesome. Then that cue, draw your belly button to your spine, worked for you. It doesn't work for everybody. If you didn't feel your muscles contract, another cue you might try is to pull your abdomen away from the waistline of your pants. So, drawing the skin of your stomach away from the waistline of your pants. As you do that, can you feel the muscles contracting beneath your fingers? If so, that's great. You've activated your transverse abdominis. What if you're still having trouble? That is normal for a lot of folks in midlife. Another thing we can try is to breathe into your belly. And as you exhale, exhale forcefully like you're fogging up a mirror. Keep that exhale going until you've really emptied your lungs. And do you feel your muscles contract below your fingers when you do that? Those are those muscles contracting. That's their transverse abdominis at work and contracting. Now, with those muscles contracting, I want you to breathe in and out. As we breathe, we should be able to maintain that contraction. If you find that challenging, you're not alone. A lot of folks in midlife do. Even folks who exercise a lot might struggle with this. If you find it hard to maintain that contraction while breathing, then the exercise I want you to do is to do this and just breathe in and out. Work your way up to it until you can get to breathing in and out 10 times while maintaining that contraction. And then you don't relax the contraction in between. You don't want to be contracted forever. Once you can, maintain that contraction and breathe in and out 10 times, practice that maybe, a couple times a day, 5 days a week. Once you can do that, then the next progression is to maintain that contraction, lift our heels. Hopefully you can see that. Once you can do that 10 times on each side while maintaining the contraction, next progression, just lift up, kind of march. Once you can do that, maintaining the contraction and breathing, throughout all of this we are breathing. The next progression, can you lift up your hands, maintain that contraction. And then if you can do that 10 times, then the final dead bug progression is hands and feet up in this tabletop position and extending opposite arm and opposite leg. All the couch is in my way on the right-hand side here, but hopefully you can see that okay. All the while I'm maintaining that contraction and continuing to breathe. Now, something you should not feel in this exercise, we should not feel any strain in our neck. We should not feel any strain in our back. Those aren't the muscles we want to be recruiting to do this exercise. So if you're feeling strain there, it means that you're probably having trouble recruiting your transverse abdominis and are trying to use those muscles instead. And so I would encourage you to go back to an earlier progression if you start to feel strain in your neck or your back. So I hope you found that video helpful. Build yourself up to being able to do the full version of the dead bug, 3 sets of 15 on either side. And that should set you up to be able to safely get into resistance training and get all those pretty amazing benefits that come with doing resistance training as we age. All right, thanks guys.